Tokyo Senbai Hospital is located in the center of Tokyo. Here, we see various kinds of patients with voice disorders, including singers, actors, teachers, and TV reporters. In this video, our method of pushing exercise will be shown. Pushing exercise is beneficial for patients with incomplete vocal fold closure, such as unilateral recurrent nerve paralysis, sulcus vocalis, and bowed folds of aged patients. Before we start actual pushing exercise, we give simple but careful orientation to the patient so that the patient could understand the rationale and necessity of the exercise. We briefly explain the purpose of the exercises, mechanism of the larynx, and how to use the monitors. Use of simple figures of the larynx is useful in helping the patient understand the purpose of the exercises.
閉じると閉じさせるというような訓練を今日しますから、あんまりそればっかりやってるとなにわ節的な声になっちゃったり、お相撲さんのみたいな声が低い声になっちゃったりするんで、そんな何回もやりません。
This 52-year-old female patient has bilateral sulcus vocalis. During exercise, it is better to use some kind of visual feedback monitors. We generally use a phonolaryngograph, and sometimes we use a VisiPitch and an electroglottograph. Phonolaryngograph shows 3 parameters: flow rate, intensity, and pitch, simultaneously in real time. Just push the button, and then the machine immediately shows each parameter separately. By moving the cursor to the level of the recorded data, the score is shown in the upper right of the screen. A contact microphone is placed on the patient's neck just at the level of her vocal folds. In order to record the baseline data, the patient is requested to phonate in 4 different modes: the loudest voice, the softest voice, the highest pitch, and the lowest pitch. And then we examine whether the patient's voice quality and loudness change when we add digital pressure to the both sides of the patient's neck. This digital manipulation has a diagnostic value to determine whether pushing exercise is effective or not. After these procedures, actual instruction of the pushing exercise is given to the patient. This 67-year-old woman has a history of left vocal fold paralysis. At first, the patient is instructed to synchronize the adduction of the folds with the pushing movement of the upper extremities and the neck. Usually, we ask the patient to hold the breath suddenly when she is pulling up the chair she is sitting on. At this time, the target level of intensity is about 10 dB louder than his or her loudest level of the baseline data. Here, the patient is reminded that the most important thing is the adduction of the vocal folds. The target level is shown on the screen. With pushing movement, the patient is asked to phonate in a vowel E. This patient is trying to adduct the glottis by pulling her hands apart. During the hand pulling, phonation is sustained.
と最初に詰めてからってそうですね、最初にってこういう感じです。こうはいどうぞ。はい、喉詰めてからしましょうか。詰めてみてください。詰めてから詰めてから開かないでそうです。そのままパッと声出せばよろしいんですね。はい、いいですよ。
Around at this stage, pushing movement and adduction of the vocal fold should not be achieved with excessive force, but with gentle and slow manners. Here, the patient has to be reminded that the most important thing is adduction of the vocal folds. In the next stage, the patient is asked to phonate as long and loud as possible. The target level is set at 10 to 20 dB higher than before. The target of this exercise here is to monitor the target intensity level of the screen while consciously trying to adduct the vocal folds. The patient can confirm the achievement of loud voice through auditory and visual mode by using this machine. It is easy for a clinician to encourage the patient as objective data is immediately presented to her.
これで今度これやりますかね。詰めてっていう感じでやってみましょうか。はい。落ちないようにの締めっぱなしで、はい。いいですね。はいどうぞ。そうです。ここがちょっと長めになるといいんですけど、はい。今のをね、少し長めに言ってくださいますか。今のってなりましたけど、もっと声出ますので、持ち上げたまんまと伸ばしてやってください。はいどうぞ。はい結構です。今のをもう一回やってください。はい。結構です。ではここやってください。
Finally, the patient phonate without actual pushing while only imagining that she is making pushing movement.
ついたような感じがしてきました。そうですね。こういう感じなんですね。押しますけどね。
For the preparation of carrying over this phonation mode in the situation of daily conversation, hard glottal attack for the initiation of phonation can be used.
大丈夫、出てきました。こうやってね。結構ですね。そのってやるときに喉をギュッと詰めてくださいますか。
Pushing exercise is very effective for the treatment of incomplete glottal closure, but it can be harmful to the vocal folds if it is not conducted properly. Adduction of the vocal folds with excessive force might cause laryngeal polyps or nodules. Therefore, we carefully select the amount of force used in the exercise and the duration of exercise to avoid possible secondary vocal problems. The actual procedure to avoid phonation with excessive force will be demonstrated later.
掴んで発声の準備ができてからいきますが、掴みまして 普通はいそうですね A って言っての A って言ってみてください。はい、
In an advanced session, carrying over of sufficient glottal closure with hard glottal attack on vowels is attempted using words, phrases, and sentences.
ちょっとだけ大きい。
はい、いいお声ですね。大きいあゆと言ってみます。全部の声をしっかり押し上げながら全部の声に大きいにもあゆにも力が入るつもりで
続けてるんです。
続けてどうぞ。はい。
大きいあゆ。
はい。大きいのところもう少し力を入れてから大きいあゆ。ちょっと目を向いた感じですけど。
大きいあゆ。
はいですね。もう一回いきましょうか。
大きいあゆ。
少し大きめの口を開けておっしゃって、もう少し大きな声が出るかなと思うんですが。
はい。大きいあゆ。大きいあゆ。大きいあゆ。大きいあゆ。
喉ヒリヒリしませんか？
少しします。
しますね。はい。
Sometimes, flow rate during phonation is monitored using phonolaryngograph for learning effective control of respiration. For better exhalatory control, smooth and stable airflow rate from the beginning to the end of phonation should be observed. This 57-year-old patient with bilateral sulcus vocalis visited our clinic demonstrating strained hoarse voice. Video fiber optic observation revealed over-adduction of the false folds, possibly for the compensation of the incomplete glottal closure.
はい、どうぞ。広がってますか？はい。はい、どうぞ。ではですね。
We have used an easy and effective relaxation technique to release the over-adducted false folds. The patient is requested to yawn or pretend to yawn while he phonates. He may be instructed to yawn hard internally rather than to yawn openly in order to facilitate the wider abduction of the false folds. Pretension of a situation in which he almost bursts into laughter, but he has to suppress it, is also very effective. Using a fibroscope, we have confirmed that this relaxation technique easily releases the hyperadduction of the false folds and strained phonation is eliminated.